Hello, welcome to this introduction to Quantitative Bioimaging Laboratory. My name is Baowei Fei. I'm a professor of bioengineering at the University of Texas at Dallas, and also a professor of radiology at the UT Southwestern Medical Center. My research lab focuses on biomedical imaging and computing. Our research project involves imaging, data science, artificial intelligence, and image-guided surgery. I will briefly cover a couple of projects. One of my research areas is called Hyperspectral Imaging HSI. This is a technology that was originally developed by NASA for Earth observation. We are using this technology for biological and medical application. This is not trivial because we are looking at the cellular and molecular level, and it requires very high spatial resolution and high sensitivity. As you can see, each pixel has a spectral signature that can be used to detect disease. So what is the premise of using hyperspectral imaging for cancer detections, for example? During the neoplastic transformation, tissue architecture and the morphologic change lead to the change in tissue optical properties and lead to the change in diffuse reflectance. So hyperspectral imaging measures the diffuse reflectance from tissue surface, carrying quantitative information about the tissue structure and composition, which can be analyzed to detect tissue physiopathology. If we look at cancer tissue and the benign tissue, we can see a difference at the molecular level, cellular level, tissue level, and also physiological levels. These differences can be quite complex. The change in the reflectance hyperspectral imaging can be due to all these changes. This brings some challenges and also brings some great opportunities. In this review paper, we summarize different applications and different hyperspectral imaging technologies. This is one of the top downloaded papers from Journal of Biomedical Optics, with more than 1,000 citations based on Google Scholars. In the past years, we performed a clinical study of 204 human patients using hyperspectral imaging. Two PhD students, Guolan Liu and Martin Halisak, worked on this project in the past years. Each of the students published more than 20 papers when they work in my research laboratory. We also had a surgeon, Dr. Amy Chen, and a pathologist, Dr. James Little, on this study. So we recruit a patient who undergo head and neck surgery, and for each patient, we collected 3 types of tissue during surgery. It includes cancer tissue, normal tissue, and a mix of tumor and cancer tissue. We developed a standard protocol for imaging acquisition of this tissue. We have worked with pathologists to establish histologic ground truth for each tissue. So we developed artificial intelligence technology for cancer detection. So in this study, we use Inception 4 convolutional neural network, as shown on the left side. So the CNN architectures are customized for the hyperspectral imaging cube. We use TensorFlow, Python, and the NVIDIA GPU. And the result shows that the AI algorithms and hyperspectral imaging are able to detect the tumor margin with the accuracies of 90%, and for conventional squamous cell carcinoma, and 97% for HPV positive squamous cell carcinoma. That's a very exciting result. So our goal is to use real-time hyperspectral imaging for cancer detection during surgery. We are collaborating with Dr. Gustav Kaniko's group, where a demonstrator system has been used for brain tumor surgery in 36 patients. we developed a deep learning-based framework for in vivo detections of glioma and tumors using hyperspectral imaging of human brains. So we are further developing augmented reality system for image-guided surgery. The image on the left side shows the testing of our augmented reality systems, and this is an ongoing research project. Another area in my research lab is data science and image computing. The connection of electronics data along with biomarker and imaging will provide a rich source of data for identifying new factors contributing to health and disease. So those rich data plus reference database plus AI algorithms will aid clinicians to make early detection, precise diagnosis, and a more effective treatment for each individual. So data itself know nothing. However, given biomedical context, it becomes information. So we can know some relationship from the data. Given biomedical meaning, the information became knowledge. The information shows some pattern, tell us why. Given biomedical insight, the knowledge becomes wisdom. So we understand what happens. What is the principle? What is the mechanism behind? Give clinical purpose, the wisdom will help us make clinical decision. You can better treat patient or even do some prevention. This is a new paradigm from data to information to knowledge to wisdom and to clinical decision making. In next slides, I will give an example on how we use imaging and data for improved patient care. So one area is cancer imaging, early detection, diagnosis. Here we focus on one type of cancer, prostate cancer. It's one of the leading causes of cancer mortalities. The definite diagnosis for prostate cancer is biopsy. There are more than 1 million biopsies each year in the USA. Transrectal ultrasound is used to guide biopsy. It is called truss-guided biopsy. Unfortunately, this standard truss-guided biopsy can miss up to 30% of prostate cancer. We call it blinded biopsy. So in this project, we develop a new imaging method and try to improve the cancer detection rate. So in the past year, my lab combined multiple imaging modalities together to guide prostate biopsy in order to improve the detection accuracy. So we combined positron emission tomography PET with three-dimensional ultrasound imaging for targeted biopsy of the prostate. This project includes imaging technology development, mechanical design, software design, algorithms. This is the clinical setup for our patient study, the first in human trial of PET molecular imaging directed 3D ultrasound guided targeted biopsy of the prostate. Through this trial, we published that we are able to improve prostate cancer detection in human patients. Our research has direct impact on patient care. So myself, as a biomedical engineer, we're proud of being a biomedical engineer in the past decade. I'm also proud our work can help save life and improve human health. So I envision that imaging and robotics will play a critical role in future medicine. This is a big picture for the operating room in the future. I hope to bring advanced technology to the surgical room with high precision, where all the data are integrated together for better decision making. We have the artificial intelligence tools, we have the augmented reality technology to see through the body for precise location of the lesion, for minimally invasive surgery. So the surgeon have the capability of detecting tumor in real time at the cellular and molecular level. So the operating room of the future will have the integrated data, advanced imaging technology, and the computation power to improve patient outcome. So with the support from the university and our faculty, I was able to establish the Center for Imaging and Surgical Innovation at UT Dallas and UT Southwestern. So the center is to provide a platform to promote collaboration between UTD and UT Southwestern. So I envision that imaging and computing will be a leading force in future precision medicine, where quantitative method of engineering and computer science will have a pivotal role in disease detection, diagnosis, treatment, including image-guided surgery. With this center, we want to shape and advance imaging and surgical technology through innovative research and inspiring education, with the goal to establish UTD, UT Southwestern as a national leader in the field. Finally, I would like to thank my collaborator at UT Southwestern Medical Center, Emory University, the University of Las Palmas, Gran Canaria in Spain. Our research projects are supported by National Institutes of Health, the Cancer Prevention and Research Institute of Texas, and UT Dallas and UT Southwestern Medical Center. I have the opportunity to work with many talented students. I'm recruiting undergrad and graduate students and a postdoc into our research program. Please visit our lab website for more information and send me an email if you want to do some exciting research project. Hope your career and bright future starting from here. Thank you.